Hello everyone. Here I am going to discuss the ultra important topic that is necrosis. In this session, I am going to compare the 5 type of necrosis, that is coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis and fibrinoid necrosis in a comparative unique manner so that you can't forget it. You usually very frequently get a long question on necrosis. So you will be asked to define and write the gross and microscopy of all 5 type of necrosis. That will be a long question, and sometime in the short question one of the 5 can be asked, or you can be asked to write the differentiation between the two. So we are going to cover everything about the necrosis. Let's start it. So let's start the ultra important topic you all can see here, that is necrosis. So first of all, I'm giving you the definition of necrosis. You should understand what is necrosis, define it, and then tell me the 5 type of necrosis, that is coagulative necrosis, liquefactive necrosis, caseous necrosis, fat necrosis and fibrinoid necrosis. You have to tell me the introduction of each of them, the causes of each of them, the gross of each of them and the microscopy of each of them. So let's start it. So before starting the necrosis, there is an introduction. I guess in the last session also, you may have watched my session on apoptosis. You may be knowing there are 2 types of cell death. You can see this is a cell. This cell is in homeostasis. In human body, from head to toe, we are made up of millions of cells. And all these cells are in homeostasis. So whenever any stress is acting on the cell, the stress may be physiological, maybe pathological. Then 3 things happen one by one. First of all, the cell try to adopt by doing certain structural modifications inside that. So this is known as cellular adaptation in order to cope up with the stress. So cellular adaptations are there. If the stress continues, then the second thing happening is reversible cell injury. If the stress still continues, the third and the last thing is the reversible cell injury. Actually, reversible cell injury is equal to cell death. So if the stress continues, the summary is that the cell will die. There are 2 mechanisms by which the cell will die. Either the cell can commit the suicide or the cell can commit the murder. So suicide is compared with apoptosis and the murder is compared with necrosis. So basically there are 2 mechanisms by which the cell can die, apoptosis or necrosis. Whenever a person commits suicide or whenever there is a person who is murdered, in both the scenarios the person will die. But the mechanism is different. In the same way, here also I am telling you apoptosis and necrosis, in both of them the cell will die. But the mechanism will be different. Why I am comparing apoptosis with suicide and necrosis with murder, I will explain you that also. So let's start it. So let me tell you first of all the definition of necrosis. Here in this session we are going to cover the murder. The murder is the necrosis. The suicide is already covered. I mean the apoptosis is already covered in one of the session. You must watch that also. Watch the suicide and murder back to back, the 2 sessions together. You will have a better understanding if you are understanding the 2 apoptosis and necrosis together. So let's start necrosis. What is the definition of necrosis? So necrosis is also a type of cell death. It is a type of cell death. It is the death of cell in living animal. So death of cell in living animal, one of the type of cell death is necrosis. Here there is a localized area of the dead tissue. Localized area of dead tissue is there, followed by degradation of the tissue, and there is always inflammation in contrast to apoptosis. So in apoptosis the cells shrink and the cell is phagocytosized. So it is silently. There is no leakage, there is no inflammation. In contrast to that, in necrosis, can you see this cell? In necrosis the cell rupture. Once the cell will rupture, everything leaks out, see, and then inflammation is there. So here the cell rupture, the cell swells and rupture. So here first thing, the cell swells, swelling is present. Then the cell rupture, the cell is rupturing, rupture is there. So because the cell is rupturing, leakage is there. You can appreciate leakage, the cytoplasm is leaking out. Since leakage is there, it is always associated with inflammation. Inflammation is always there. And in contrast to that, this is all about necrosis, I'm telling you. This is all about necrosis. In contrast to that, in apoptosis, the cell do not swell, rather the cell shrink. The cell shrinkage is there. So shrinkage is there, swelling is not there. Rupture is never there. Because cell is shrinking. Rupture is never there. No rupture, no leakage, no rupture, no leakage, no inflammation. So whenever a person does a suicide, it's silently. Whenever the person commits a suicide, it's not like the person is taking a mic, loudspeaker and announcing I'm doing suicide. No, it's privately, it's silently, it's privately. So in the same way, there is no leakage, there is no inflammation, there is no rupture. The cell is shrinking and disappearing. because it is phagocytosized. So that's why we compare the apoptosis with suicide. But imagine a person getting murdered. The person will there is a person who is getting murdered. So what does the person will do? Person will shout, help, 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 right? So here the cell will swell, the cell will burst, the cell will rupture, leakage is there, and multiple people are coming for the help. That is, inflammation is present. That's why I am comparing the necrosis with the murder. One more thing you can correlate, the suicide is done by one person. So apoptosis occurs of a single cell, but multiple persons can be murdered together at one time. So necrosis occurs of a group of cells. That is how we can compare the apoptosis with the suicide and the necrosis with the murder. I hope you all got it. So this is the thing. So here you have to define what is necrosis. Necrosis is a type of cell death in which the cell, the group of cell, there is a localized area. That is the group of cell which are dying. They are always associated with inflammatory reaction. It is always. Now I will explain you the 5 type of necrosis in a unique manner. But before that, you have to understand in a cell, there are 3 details. Acha, you tell me how many cells are present in human body. How many type of cells are present in human body? How many type? You will say, ma'am, there are many cells present in human body. Can you identify the various cells in human body? Let me show you in a diagram. Can you see this is a muscle, this is a stem cell, this is intestinal cell, this is RBC, this is liver cell, this is heart cell, this is nerve cell. There are many cells. Can you identify the different type of cell? You say, yes, we can identify the different type of cells based on the shape of all the cells is different. The cytoplasmic details of all the cells is different. The cytoplasm have different color, different granularity, different amount. In some cells, the cytoplasm is abundant. In some, it is scanty. The color is different. In some, the cytoplasm is eosinophilic. In some, the cytoplasm is basophilic. Sometimes the granules is present. Sometimes the granules is absent. And looking at the nucleus, nuclear detail. Nucleus, the location of the nucleus can be central, can be peripheral, the nucleus can be compact, hyperchromatic, it can be vesicular, and the size of the nucleus. So basically looking at 3 details, the shape of the cell, the cytoplasmic detail, and the nuclear details. See, shape of all these cells is different. See, the cytoplasmic color and details is different, and see, the nucleus is different. Based on these 3 things, we can identify a cell. So if you want to identify any cell in human body, if you want to identify any cell in human body, you require 3 details. What 3 details? You want architectural detail, that is the outline of the cell. You want cytoplasmic detail, and you want nuclear details. See the outline. Outline is the shape. Shape or outline is known as architectural detail. The cytoplasmic detail and the nuclear details. So if I provide you 3 details, there is a cell, this is a cell. And if I provide you 3 details about this cell, if I tell you the architectural detail, that is I tell you the shape of the cell. The cell is a circle, spindle, whatever. If I tell you the cytoplasmic detail of this cell, and if I tell you the nuclear details of this cell, can you identify the cell? Yes. So we require 3 details for identifying a cell. So this is for identity of a cell. If you got this basic knowledge, the 3 details, please learn the name of the 3 details. Architectural detail, cytoplasmic detail, cellular or cytoplasmic detail, and nuclear detail. So if we are having these 3 details, we can identify a cell. If you got this concept clearly, let's start the 5 type of necrosis. Coagulated necrosis, liquefacted necrosis, caseous necrosis, fat necrosis, and fibrinoid necrosis. I request all my dear students to make a comparative table between them right now. So if you are studying from the app, you are having the soft copy of the notes. So please make a comparative table in any of your notebook. Take out your notebook, take out your pen, and make it right now with me. So it will fit in your permanent memory. And if you are having the hard copy of my book, so if you are having, so this empty table is given there. So you can fill in the book itself so that it will be like a workbook for you, right? So let's start it. So for each of the 5 type of necrosis, I will tell you the definition for them, then the causes of each of them, the gross and the microscopy. So I will also fill this table with you. So let's start with the first one, coagulative necrosis. Tell me the introduction. Among the 5 type of necrosis, this one is the most common. Among the 5 type, the first one is the most common, that is coagulative necrosis. So let's start the coagulative necrosis. See the introduction, it is the most common type of necrosis among the 5. Now here, can you see? Define it. See. This is the cell. This is a group of alive cell. Can you see? Few cells are there. I can see 4 cells. They are alive. What do you mean by that? I can see 3 details. See their shape. I mean architecture. See the color of the cytoplasm. It's light pink in color. And see the color of the nucleus. So based on the three detail, I can identify the cell. See the shape, see the cytoplasm, see the nucleus. Based on the three details, I can identify it. Now, this cell undergo dead. The group of this cell is dead now because of coagulative necrosis. So see the difference. You will see, ma'am, still I can see the same shape. Now compare the shape here, compare the shape here. You will see the shape is exactly same. There is no difference in architecture. So architecture is still maintained. You all can see the architecture is still maintained. We can compare the shape. So here and here, the shape is exactly same. The architecture is maintained. See the shape here, see the shape here. But see the cytoplasm, it's changed. Whatever the color amount is there, now here different color, different amount is there. So cytoplasmic details is lost. And see the nucleus. Here we have a uniform single nucleus. Here nuclear details are also lost. Some cells do not have nucleus, some have fragmented nucleus. So basically out of the three details, only architectural detail is persisting. But the cytoplasmic and the nuclear details are lost. So out of the three details, architectural detail is persisting, but cytoplasmic detail is lost and nuclear details is lost. So we can see only the shape of the cell, but cytoplasm is gone, the nucleus is gone. So this is the definition of coagulative necrosis. In coagulative necrosis, only shape retain, architecture retain, outline retain, but the cytoplasm and the nuclear details are lost. This is coagulative necrosis. So can I say the cell is looking like a ghost? Have you ever seen a ghost? I have not seen. I have seen in the movies, but okay, I have seen. Okay, so what is a ghost? Ghost is someone who's having only outline. Okay, ghosts don't have any inner detail. No detail. So can I compare the cells in the coagulative necrosis with the ghost? They have only outline. Here cells also have only outline. So that's why the cells of the coagulative necrosis are known as ghost cell. Got it? Or can I say the cells here are looking like a tombstone? What do you mean by a tombstone? Tombstone is a stone which is put over a graveyard. So tombstone is a stone having only outline. Having only outline. Stone don't have inner detail. So in the same way, I can say the cells in the coagulative necrosis are having tombstone appearance. So either you say ghost cell or tombstone cell. So still, because the outline is maintained but inner details is lost, we can recognize the type of the tissue. So tell me coagulative necrosis. What is coagulative necrosis? Define it. Define it. Say, ma'am, out of the three details, architectural details still persist. It still persists, but the nuclear detail is lost and cytoplasmic detail is also lost. Since we can see only outline, no inner detail, we call the cell as ghost cell or we call the cell as tombstone cell. So that is the two names given to coagulative necrosis. Coagulative necrosis is known as ghost cell or tombstone cell. Got it? Since the outline still persists, we can still identify the type of the cell. This is all about coagulative necrosis. Now coming on the causes of the coagulative necrosis, we have seen the definition. Causes. There are three causes of coagulative necrosis. Number one, ischemia. What do you mean by ischemia? From head to toe, we have multiple organs. All organs, all cells are provided with blood supply. If any of my organ is not supplied by blood, the cells of that organ start dying by coagulative necrosis. So any of my organ, it can be kidney, liver, heart, any organ. If that organ is not getting the blood supply, the cells of that organ start dying by coagulative necrosis. So ischemia of all organs, but except, there is an exception, brain. If the brain do not get blood, the cells of the brain also die, but not because of coagulative necrosis. It will be because of liquefactive necrosis, the second one. So ischemia of all organ leads to coagulative necrosis, but ischemia of brain leads to liquefactive necrosis. So let me show you in this diagram also. Let me draw a rough sketch diagram of a human being. This is a rough sketch diagram I am drawing for a human being. You can see now in human being there are multiple organs. Let me draw a few of them. Okay, there are multiple organs: heart, lung, liver, spleen, kidney, multiple muscles are there, bones are there, multiple organs are present here and there. Okay, and there is brain. There is brain also. Now if ischemia occurs in any of the organ, the cells of that organ start dying because of coagulative necrosis. But if there is ischemia of the brain, the cells of the brain also start dying because of liquefactive necrosis. How many of you got it? So please learn it. So here ischemia of all organs except brain. Now if there is burns, someone is having burns anywhere on the body. Just suppose there is a burn, small area of burn or large area of burn. So cells of that particular area is dead because of the burn. That is the thermal injury. So it is because of coagulative necrosis. So burns or thermal injury is due to coagulative necrosis. And third is Janker's degeneration. So it is also an example of coagulative necrosis. Learn the three examples. Ischemia of all organ except brain, burns, that is thermal injury, and Zenker's degeneration. These are the three causes. What about the gross? We have seen the definition, we have seen the causes. Now coming on the gross. In the gross, the organ is little bit pale, firm, and slightly swollen. See, it's pale, firm, and swollen. See again, it's pale, firm, and swollen. So organ become pale, firm, and swollen. You can see it rather than learning see in the diagram. Coming on the microscopy. Now, if I cut it and make a slide, this is the diagram. Now, we can draw any organ, but here kidney is shown to you. I guess you all can see this is a diagram of kidney. Now, in this diagram, you all can appreciate three areas are shown to you. You all can appreciate in this diagram, we can see this side is the normal kidney. Okay, this side is the kidney having coagulative necrosis, and at the junction of the two, we can see the inflammation. So necrosis is always associated with inflammation. Never forget to draw inflammation. So at the junction of the two, there is inflammation. We can see the lymphocytes, inflammatory infiltrate. What about the normal kidney? We can see the glomerulus, we can see the tubules. It can be PCT, DCT, loop of Henry. See the tubules. I want you to appreciate the cells of the tubules. Can you see the cells of the tubules? They have the outline. These are the cells. They have the cytoplasm, cytoplasmic detail, and nuclear detail. All three details are there. They have the outline, cytoplasmic detail, nuclear detail. All three details are there. This side is viable. Viable kidney. Viable. Now see the necrotic kidney. You will see outline is still there. So outline is still there. We can see the outline of the tubules, but the cytoplasmic detail is lost. You can see the cytoplasmic details is lost, and the nuclear detail is also lost. We cannot see the nucleus or very small pycnotic nucleus. So only outline is maintained. Remaining two details are lost. That is the tombstone appearance. So again, the same thing you have to write that you have written in the definition. Outline persists, but cytoplasmic detail and nuclear detail is lost. So that's why the cells are known as tombstone. So whatever you are writing, you should be able to draw it. So and at the junction, there is always the inflammation. You can see the lymphocytes at the junction. So if you want me to draw the diagram of coagulative necrosis in my university exam, I will draw a box like this, and I will divide it into 3 columns roughly. Roughly, I will divide it. Now this side, I will draw the viable tissue. I will draw the kidney. I can draw anyone except brain, but I'm drawing the kidney, viable. And here I'm showing you the coagulative necrotic kidney. And at the junction, I will show you the lymphocytes. So this side, I will draw the tubules like this. I will divide it into the cells. These are the cells lining the tubules. And or rather you can draw like this. If you have trouble in drawing like this, you can draw like this. So this is the lumen of the tubule, and these are the cells lining the lumen of the tubule. So this is the tubular cells. This is again the lumen of the tubule lined by the cells. Now the cells have an outline, the cells have cytoplasm, the cells have well-defined nucleus. They have outline, they have cytoplasm, they have well-defined nucleus. Fill the color of the cytoplasm also. Now on the next side, again draw the same shape. The shape is still retained, but cytoplasmic detail is lost, and nuclear detail, hardly you see any nucleus, or if it is present, it is fragmented, or the nucleus is absent. So nuclear detail is gone, cytoplasmic detail is gone. You draw only the outline, and at the junction, try to draw the lymphocytes. This is how I will always tell you. This is how you have to draw the diagram in university exam and label it properly. Labeling is important. So label these cells as tombstone appearance cells. And you can label the outline is maintained, but the other two details are lost. If you are doing the labeling properly, I will give you full marks. This is microscopy. So same thing is shown to you here also. You can appreciate the tubules here, appreciate the lumen, appreciate the cells lining the tubule here, okay, on this side, and appreciate this side. This side you can see only outline is there, the ghost is there, and the inner details are lost. So this is how you have to draw. So try to draw it by your own, practice it before going to your university exam. We are done with this. So please read this column. So coagulative necrosis. What is coagulative necrosis? Tell me. So coagulative necrosis is the necrosis in which architecture is maintained. See the plus sign. But cytoplasmic detail is lost, nuclear details is lost. That's why we compare the cell with a ghost cell or tombstone cell. Write down. What are the causes? Say ma'am, ischemia of all organ except brain. So second is burns, and third is Janker's degeneration. What about the gross? Here the organ is pale and swollen, little bit swollen, and microscopy, the cells look like the tombstone. So we are done with this. Coming on the second type of necrosis, it is liquefactive necrosis. So what will happen in liquefactive necrosis? Again, see a group of alive cell here. Can you see the group of alive cell? Now the cell, this is alive. They have all three details. You can see their outline, you can see their cytoplasm, you can see their nucleus. All three details are there. It undergo liquefactive necrosis. You will say, ma'am, I can't see the cell. The outline is also gone. The cytoplasmic detail is also gone. The nuclear detail is also gone. So all three details are gone. In contrast to coagulative necrosis, where at least outline was maintained. At least outline was maintained. Architecture was maintained. But here all three details are gone. So if you say here, in coagulative necrosis, architecture persists, but cytoplasmic and nuclear details are gone. Here all three details are gone. Architecture also gone. Cytoplasmic details also gone. Nuclear details also gone. See, compare. So here all three details are gone and the group of live cell get converted into a gel-like material. A gel-like material. That's why it is known as liquefactive necrosis. It is known as liquefactive necrosis. Just a second. Why it is known as liquefactive necrosis, you can see. Just a second. Okay. So because here it got converted into a gel-like material. That's why, because of the gel-like material, it is known as liquefactive necrosis. So what is the definition? In the definition, architectural detail is lost, cytoplasmic detail is lost, and nuclear detail is lost. All three details are lost. And ultimately, the group of cell get converted into a gel, semi-fluid-like material. That's why it is known as liquefactive necrosis. So compare with the coagulative one. Causes, one cause you already know. Ischemia of all organ leads to coagulative necrosis, but ischemia of brain leads to liquefactive necrosis. And if there is any pyogenic infection in any organ, what is pyogenic infection? Pyogenic bacterial infection are the infection in which the pus is formed. You know, pus is a liquid. It's a liquid, semi-fluid. So in pus, whenever there is pus in human body, anywhere due to bacterial infection, pyogenic bacterial infection, it is due to liquefactive necrosis. So that is the causes here. So let's come on the gross of the liquefactive necrosis. So here in the gross, you can see there is a cavity. Now you can identify the organ. Here the organ shown to you is the brain. I told you it occurs in ischemia of the brain. So ischemia of all organ leads to coagulative necrosis, but ischemia of brain leads to liquefactive necrosis. So here I am telling you the gross of the liquefactive necrosis. You can see the organ is the brain. It's the ischemia of the brain in which liquefactive necrosis is there. And you can see there is a cavity. You can see a cyst is there. A cavity is there which is containing a liquefied center, which is containing a gel-like semi-liquid center. So this is the gross. Coming on the microscopy. Now here in the microscopy, can you identify the organ? The organ is the brain. So in gross also the organ is shown to you brain intentionally, and in microscopy also the organ shown to you is the brain only. You can identify on one side, this is the normal brain, the viable brain. On the other side, it is the liquefactive necrosis in the brain, and at the junction of the two, there is inflammation. So the diagram is in the similar way as that of coagulative necrosis. Here also you can see the three areas. So here see the viable brain. Can you see the viable brain? What you can see? You can see the neurons, you can see the cells. See their three findings. See their outline, see their architecture, see their cytoplasmic details, see their nuclear details. So they all have the outline, they all have the cytoplasm, they all have the nucleus. On the contrary, see the liquefactive necrosis. What do you see? You can't see anything. You can see certain dot like material. I can't see any outline, no architecture. I can't see any cytoplasmic detail. I can't see any nuclear detail. So all three details are gone here. All three details are gone in contrast to coagulative necrosis where at least architecture was maintained. Here all three details are gone. What we can see? The liquefied debris, the liquefied dot like material. And at the junction of the two, I can see the inflammatory cells. These are the plasma cells and the lymphocytes, and we can see the blood capillaries also. So basically at the junction, we can see the inflammation. So this is the microscopy. So we can see a cavity wall at the junction, and here on one side the viable brain, and on the other side it is the liquefactive necrosis where all three details are gone. So now compare. We are out of the 5, the 2 are done. 2 type of necrosis are done. So we are done with the coagulative necrosis, we are done with the liquefactive necrosis. Can we compare the two together? In coagulative necrosis, the architectural detail was maintained, but cytoplasmic detail and ghost, the nuclear detail is lost. That's why the cell is known as ghost cell or tombstone appearance. In contrast to coagulative necrosis, in liquefactive necrosis, all three details are lost. No architecture maintained, no cytoplasmic detail, no nuclear detail. And complete group of cell get converted into a liquefied, semi-liquid material, gel-like material. Tell me the causes of both of them. Here ischemia of all organ except brain. And here we have ischemia of brain along with pyogenic pus-like infection. Tell me the gross of both of them. Here in the gross, I told you the organ look pale and swollen. Remember the diagram of the liver and spleen I have shown you? Here, the diagram of the brain, can you remember? There is a cyst and inside which there is a liquefied center. Now tell me the microscopy of both of them. Here, the cells, I have shown you the diagram of the kidney. One side normal kidney, other side necrotic kidney, and at the junction there is inflammation. Here I have shown you the diagram of the brain. One side normal brain, One side necrotic brain, and at the junction there is inflammation. Now coming on the next necrosis, that is caseous necrosis, the third one, caseous necrosis. So see here, what is happening here? Here, this is a group of live cell. You can appreciate the three details. What are the three details we are having? We are having architectural detail, we are having cytoplasmic detail, we are having nuclear detail. All three details are there. Okay, now here it got converted into caseous necrosis. What you can see? No architecture is lost. No cytoplasmic detail, no nuclear detail. So all three details are lost. You may be thinking, ma'am, all three details are lost in liquefactive necrosis also. Here also all three details are lost. But here ultimately the cell get converted into gel, the liquid material. Here the cell get converted into granular debris. Can you see the dot like the granular debris? So that is the difference. And due to granularity, it looks like cheese. Have you seen cheese? How does the cheese look like? Let me show you. This is the cheese, the cottage cheese. The cheese is dry, the cheese is granular, and the cheese is yellowish in color. Here the necrosis also look like this, dry, granular, and yellowish in color. That's why it is known as cheese-like, and the cheese is known as caseous. The meaning of the caseous means cheese. The meaning of the caseous means cheese. That's why it is known as caseous necrosis. I hope you got the difference between the three types of necrosis. See the diagram of coagulative necrosis, see the diagram of liquefactive necrosis, see the diagram of caseous necrosis. So basically, in coagulative necrosis, what is happening? You tell me. In liquefactive necrosis, what is happening? And in caseous necrosis, what is happening? Can you tell me the differences between the three? Here, architecture is maintained, but cytoplasmic and nuclear detail is lost. And ultimately, the group of cell get converted into ghost or tombstone. Here, in liquefactive necrosis, all three details are lost. You can see here, all three details is lost. Architecture, it's lost. Cytoplasmic detail, it's lost. Nuclear detail is also lost. In caseous necrosis, also all three details are lost. Architecture, cytoplasmic, nucleus. Then you may be thinking, what is the difference between liquefactive necrosis and caseous necrosis? Here, ultimately, the group of cell get converted into a gel-like material, the semi-liquid. And here, the group of cell get converted into granular debris-like material, which look like cheese, dry, granular, yellowish. That's why it's known as caseous. So it's crystal clear. So say the definition of all three. Definition of coagulative necrosis, liquefactive necrosis, and caseous necrosis. Learn the definitions. So this is the definition. What are the causes of caseous necrosis? Two of them are bacterial causes, two of them are fungal causes. The two bacterial causes are Mycobacterium TB and syphilis. And two fungal causes are Histoplasma and Coccidioidomycosis. So learn the four causes, two bacteria, two fungus. Now coming on the graphs, I have already shown you the graphs. The organ look, the necrotic area and the organ look granular, yellowish and dry, looking like a cheese. That's why known as caseous necrosis. Dry, granular, yellowish. Please learn that. In the microscopy, what you can see? First identify the organ. I can see a lymph node. So again, I can see the three areas as usual. What are the three areas I can see? I can see a normal lymph node here. I can see a necrotic, caseous necrosis lymph node, and at the junction of the two, I can see a special type of inflammation. Again, the three areas. What I can see in the normal lymph node? I can see the lymphocytes. They are arranged in follicular pattern. Multiple follicles are there. So I can see the lymphocytes are there. They are arranged in a follicular pattern. You can see they are arranged in follicular pattern. So they have the architecture, they have the cytoplasm, they have the nucleus. So architectural detail, maintain. Cytoplasmic detail, maintain. Nuclear detail, maintain. Everything is good to go. But here you can compare with the caseous necrosis, everything is gone. No architecture, no cytoplasm, no nucleus, only a pinkish eosinophilic material is there, which is granular debris. Cheese-like material, the pinkish eosinophilic acellular material. We can't see anything. And at the junction of the two, inflammation is there. But here the inflammation is something special. What I can see in the inflammation, I can see the giant cells in the inflammation. Oh my God, these are the giant cells. I can see the epithelioid cells in the inflammation. So inflammation is a special inflammation that is known as granulomatous inflammation. The granulomas are there. So please appreciate. Please appreciate. Here all three details are gone. Like the liquefactive necrosis only, but at the junction we are having a special inflammation here, and the name of that inflammation is granulomatous inflammation. So we are done with three till now. So three main type of necrosis are done: coagulative necrosis, liquefactive necrosis, caseous necrosis. Please appreciate the definition of all three. See the definition of this, see the definition of this, see the definition of this. Please appreciate the causes of all three. Please see the graphs of all three, and try to make the microscopy of all. Hana, try to draw the diagram of microscopy. So here I have shown you diagram of kidney, here I have shown you the diagram of brain, and here I have shown you the diagram of lymph node. In all these, I have divided the diagrams in three columns, in three portions. I mean, on one side there is viable organ, on other side there is necrotic organ, and at the junction there is inflammation. I hope you are getting it well. So coming on the fourth type of necrosis, that is fat necrosis. Fat and fibrinoid are actually special type of necrosis. One by one we will take. So let's start with the fat necrosis. What is fat necrosis? Fat necrosis, as the name indicates, it is the death of adipose tissue. Fat means adipose tissue. So death of adipose tissue in a living organism is known as fat necrosis. So tell me three organs in human body. Tell me three organs in human body where abundant of fat is present. Tell me the three organs. Number one, it's the female breast. In the female breast, abundant of fat is present. Number two, pancreas. In the pancreas, it is abundant of fat which is present. And number three, omentum or mesentery, you can say. In the mesentery, abundant of fat is there. So whenever there is trauma or inflammation in any of three organs, it leads to death of the adipose tissue, death of the fat cell, and that leads to fat necrosis. So for example, if there is trauma in the female breast in an accident, or for example, there is pancreatitis, inflammation of the pancreas, or for example, there is inflammation of the mesentery, or omentum. So that will lead to fat necrosis. So these are the three causes. So tell me the definition. It is a special type of necrosis in which there is death of adipose tissue. There is death of adipose tissue. It occurs in the female breast due to trauma, pancreatitis, or mesentery inflammation. These are the three causes. We have seen the definition. The causes gross. In the gross, you can see here pancreas is shown to you. In the pancreas, can you appreciate the yellow white deposits? These yellow white deposits are there. Yellowish white small deposits are there. Yellowish white deposits. Okay. And now in the fat necrosis, saponification is very common. The calcium soaps are formed. If saponification is there, it leads to chalky white deposits. If saponification is there, it leads to chalky white deposits. Normally it's yellow white, but if saponification, it's chalky white. Now coming on the microscopy. So here no organ is shown to you. I cannot say whether it is a breast or it is a pancreas or it is mesentery, because I can see two things only. What two things I can see? Here I can see the necrotic area, and here I can see the inflammation. The normal organ, the viable organ, is not shown to you. So in the necrotic area, I can see the necrosis is cloudy like. Say the word cloudy. It's looking cloudy like necrosis. And this is normal inflammatory infiltrate. Mixed inflammation is there. So there is cloudy appearance. You have to learn the cloudy appearance. So we are done with four types of necrosis till now: coagulative, liquefactive, caseous, and fat. Coming on the fifth and the last one, fibrinoid. Then we will compare this table in all aspects. Coming on the last one, fibrinoid necrosis. What is the definition? Why fibrinoid is known as fibrinoid? Because it is fibrin-like material which get deposited in the wall of the blood vessel. It is fibrin-like material, not fibrin-like material. And it occurs in the wall of the blood vessel. You know, blood vessel wall have three layers: intima, media, and externa. You know the three layers are there. In the wall of a blood vessel, there are three layers. There is intima, which is lined by endothelial cell. There is media, and there is externa. So in the media, a pink color ribbon is formed. Pink color eosinophilic ribbon-like material, that is fibrinoid-like material, is there, that is formed. That is fibrinoid necrosis. So the causes is vasculitis. Most important causes, vasculitis. You can see it here. So there is no gross. In the microscopy, you can see this is intima, and this is all media. In the media, I can appreciate a pink color eosinophilic mass is there. And that is known as, this pink color eosinophilic ribbon-like material is known as fibrinoid necrosis. We are done. With the five types of necrosis. Can we revise it quickly? So tell me the definition of all five. First, we will revise the definition of all five. Can we revise it? Okay. Rather than reading here, why don't we revise the definitions here? You can see if the architecture is maintained, but cytoplasmic details and nuclear details are lost. So only architecture you can see. And we can compare the cell with a ghost cell or tombstone cell. It is coagulative necrosis. So this is the definition of coagulative necrosis. If all three details are lost, no architecture, no cytoplasm, no nuclear, and the group of cell get converted into a gel or semi-fluid-like material, it's liquefactive necrosis. And if again all three details are lost, no architecture, no cytoplasm, no nucleus, and a group of cell get converted into a granular debris-like material, it's caseous necrosis. So you can compare the three necrosis. Now coming on the two special type of necrosis. Fibrinoid necrosis occurs in fat-rich tissue. You know, fat-rich, death of the adipose tissue. And the fat necrosis occurs in fat-rich tissue, fat necrosis. And fibrinoid necrosis is fibrin-like material in the wall of the blood vessel. So this is the definition of all five. Please read the definition of all five together and understand. Understand. These three are very important and these two are special type of necrosis. Now coming on the causes of all five. Can we revise the causes of all five together? Please learn the causes. So what are the causes of coagulative necrosis? Say ischemia of all organ except brain. What is the causes of liquefactive necrosis? Ischemia of brain along with pyogenic pus-like infection. Pus is also a liquid. What are the causes of caseous necrosis? Two bacterial, two fungal. TB syphilis is the bacterial, histoplasma coccidioidomycosis is the fungal. What are the causes of the fat necrosis? Three fat-rich organ. Trauma of the female breast, pancreatitis, and inflammation of the mesentery. What are the causes of fibrinoid necrosis? Vasculitis in the wall of the blood vessel. So if you have seen the causes of all five, now coming on the gross of all five. Can we revise the gross of all five together? Gross of all five. So in coagulative necrosis, the organ is pale and swollen. Can you see the organ? It's pale and swollen in coagulative necrosis. In liquefactive necrosis, there is a cyst inside which there is a liquefied center is there. So there is a cyst, there is a cavity with liquefied center. In caseous necrosis, it looks like the cheese. I mean, it's dry, granular, yellow. It looks like cheese. So here say the word yellow and firm. Here say the word cavity with a liquefied center. And here say dry, granular, yellow, look like cheese. What about the fat necrosis? It's yellowish deposits, small yellowish deposits. Its saponification occurs chalky white deposits. And what about the fibrinoid necrosis? There is no gross in that. I mean, coming on the microscopy of all five. Don't write microscopy. Please draw the microscopy. Microscopy is something you have to draw. You don't have to write. You have to draw the microscopy. See the five microscopies in front of you. So you can see this is coagulative necrosis. This is liquefactive necrosis. This is caseous necrosis. I'm really sorry. This is fat necrosis and this is fibrinoid necrosis. So you can see the microscopy of all five. You can compare the microscopy. You can see the organ. In the first three, you can see three areas are there. This is viable tissue. This is necrotic tissue. This is inflammation. And this diagram is kidney. This is viable. This is necrotic tissue. This is inflammation. This diagram is brain. This is viable. This is necrotic tissue. This is inflammation, a special inflammation, granulomatous inflammation. This diagram is lymph node. And you can see the cloudy appearance as fat necrosis. Ribbon-like in the wall of the blood vessel is fibrinoid. That's all about it.